Hey, I'm Dr. Michael Lange. We want to age as gracefully as possible, don't we? So is there enough evidence out there that proves that certain specific nutrients, ingredients, or supplements can enhance, our skin, our joints, our hair, our nails? And there's a lot of great science that's come out recently with marine collagen tripeptides, rice ceramides, hyaluronic acid, and there's a new supplement called Dermaval. Well, we've taken all four of those and we've combined it in a supplement called Rejuvenate. 3 delicious flavors, chocolate, cherry vanilla, pink lemonade, and then we have it unflavored for those of you that want to just put it in your coffee in the morning. It's worth a try. I endorse it, obviously, 100%. If you don't like it, we'll give you money back. It's as simple as that. So check it out at Fortifeye.com.
Come on more than normal? It's time to get under the hood. It's time for Ask the Doctor with Dr. Michael Lange. Sponsored by Lange Eye Institute and Fortifeye Vitamins. Dr. Lange is a board-certified optometric physician and certified nutrition specialist, helping people see and feel better through proper nutrition for 25 years. The doctor is in. Call now with your questions at 813-282-8283. That's 813-282-8283. Here's your host, Dr. Michael Lange.
Okay, good morning and welcome to Ask the Doctor. I'm your host as usual, Dr. Michael Lange of the Lange Eye Institute and Fortifeye Vitamins, here each and every Saturday morning live to answer any and all questions you may have regarding your vision, eye care, or a nutritionally related topic. So take advantage of this hour. Don't be shy. Pick up the phones and give me a call. And it's going to be give us a call in a minute because it's like a big family reunion in the station. And I'm going to talk all about that in just a second. But the phone lines are open, and it's 813-282-8283. So anywhere in the continental USA, you can give us a call. We're coast to coast this morning, and we're live video streaming all over the world. So it's good morning, good afternoon, and good evening. Give us a call at 813-282-8283. If you're new to the program, who's Dr. Lange? I'm a board-certified optometric physician, certified nutrition specialist. I got degrees in psychology and physiological optics. I started Lange Eye Care and Associates March 15th of 1993. We opened 14 eye care centers and 3 LASIK centers in the state of Florida. I now hail from the Lange Eye Institute in the Villages. Usually we have Dr. Susan Somerton co-hosting the show with me. But this morning, it's a little bit different. It's a family reunion at Salem Media. We have Scuba Scott with us. Good morning, Scoobs. How are you?
I'm good morning. I'm fine. Thank you.
It's great to have you in the studio again. You moved out of Tampa, and you're back in town for this Memorial Day show.
That's right.
And you're looking pretty good.
Thank you.
I think you've lost a little weight.
A little.
How
35 pounds since the last time I've been here.
35 pounds. There you go, folks. Scoobs is going to be a lean, mean fighting machine very soon. He's going to be in a Speedo walking down the beach.
No, I don't think so.
That would be a frightening.
Yeah.
And you hear there's a pretty famous voice right there. Everybody knows that voice. Roger P. Schulman is co-hosting the show with me this morning. Roger, I've seen quite a bit of you in the last 24 hours.
Yes, we had a lovely breakfast, a lovely dinner with chicken and green vegetables. I feel quite healthy now.
That's right. I came in late last night from working at the Lange Eye Institute and called you up. Said, meet me at the gym. I think we hit the gym about 7, 8 o'clock at night.
We did.
And we had a good chest workout. I mean, we did flat bench, we did incline, we did pecs. And I got to tell you, Roger, you are now in your 70s.
Mm-hmm.
And I have noticed over the last 15 years, you're getting stronger and stronger.
I have not deteriorated as much as I thought I would at this advanced age. And I have gotten stronger than I thought I would be at this point. You're absolutely right.
Yep. So there's no age limit to going to the gym and working out. No age limit whatsoever. And until you have 2 feet in the grave, you can continuously work out. My mom, Betty Ruth Lange, 97, she still goes in the gym and works out and still eats well. I think that's why she's 97, right, Roger?
97, and you wouldn't know it from talking to her or seeing her. She's a very beautiful woman at 97 years of age.
Yeah, she's going strong.
Yes, she is.
And Scoobs has known Betty Ruth for a long time, too.
Yes, I have. Yeah.
All right. Once again, phone lines are open. We got a lot to talk about. 813-282-8283. Roger P. Schulman co-hosting Ask the Doctor this morning. And Scuba Scott in here for moral support. All right. We got some people loading up. I see we got them. Yeah, we got everybody loading up. Let's go first. Steve in Clearwater. Steve, good morning, my friend.
Yeah, the big health topic this week was prostate cancer because of our ex-president's problem. And I thought very interestingly, I've looked in, why is it so common? In other words, like half of the people over 60 have prostate cells, half of the people over 70, almost 70% of the people over 70 have prostate cells. Why is it so common compared to other cancers? And I think I might know, I'm not sure, this is just a theory. What do we talk about a lot on this program regarding the immune system? We talk about prostaglandins. They were named for the prostate gland, prostaglandins. And it looks like the high concentration of prostaglandins, we know that taking aspirin NSAIDs can inhibit cancer growth. So it might be that that's what's stimulating it. Also, I did a lot of study on different nutrients that they've tested against prostate cancer. And it's a mixed bag. Selenium's a mixed bag. Vitamin E's a mixed bag. Although if you take vitamin E, you should take natural. There's a reason for that. But the most powerful nutrient against prostate cancer by far, and nobody disputes this, there's no negative side, is lycopene. Eating tomatoes was the one dietary thing that people do not have prostate cancer, have a lot of lycopene in the prostate. So it's just something to think about.
Well,
And go ahead.
You bring up a valid point there. And there's a couple of nutrients that I recommend to people, all men after the age of 50, is, eating a cup of organic tomato paste or tomato sauce every day, as long as you don't have a negative aversion to alkaloids. Remember, alkaloids can be pro-inflammatory in certain people. That's from nightshades, and tomato is a nightshade. But for most people, there's some interesting studies out there showing that if you had a cup of tomato paste or tomato sauce daily, it decreases your PSA numbers, okay? It helps reduce benign prostate hypertrophy. All those men that getting up and urinating all night long may want to consider that. And also pomegranates, okay? Pomegranates are pretty fascinating. Pomegranates are a great polyphenol. And think about it. Most of the people listening right now haven't had a pomegranate, most of them in their entire life. And that's one of the reasons in their new, the new Fit Meal we're developing right now, we're going to talk about more. We're using pomela, which is an extract from pomegranate, equivalent to 16 pomegranates. And that actually stimulates, those polyphenols stimulate an anti-aging nutrient called urolithin A. And it'd be interesting to correlate urolithin A and prostate issues. So yeah, tomatoes, especially the cooked tomato paste and pomegranates, are very healthy for the prostate.
Yes, and I think that, correlate to that, you're exactly right, is it might be that astaxanthin would be even more powerful in this regard because it is a carotenoid. It doesn't oxidize in the sense that it doesn't turn into a pro-oxidant after it's used. I think that, and I've looked up, there are some research on astaxanthin and prostate, and it's pretty positive.
We need to have Dr. Karen Heck. We need to have Dr. Karen Heck, the world-leading authority on astaxanthin, as a guest on the show again in the near future, and maybe we can address that. But, we all take astaxanthin. I mean, Scoobs does, I do, Roger does. We all take our Fortifeye Focus or the Fortifeye Focus and Brain, which has 6 milligrams of astaxanthin. And that is a nutrient that everybody listening in this audience, just about everybody, is deficient in. Because think about it. How often do you eat wild Alaskan salmon? And that's the only, ingredient that you can eat out there, the only food you eat that's high in astaxanthin. There's a little bit in shrimp and krill, but wild Alaskan salmon is very high in astaxanthin. And astaxanthin is the most potent antioxidant and anti-inflammatory, and it crosses both the blood-brain barrier and the blood-retinal barrier. So it is actually very good for us, and that's why we really push Fortify Focus on just about anybody at every age.
Yes, and it's very important. I agree. It's very important to get the natural astaxanthin. The synthetic is okay, but it's a different molecular structure, and it does not work anywhere near as well as the natural. I think she uses the bacteria algae or something she used.
Right, Haematococcus algae, they use it. Astereal astaxanthin is the one that we use in Fortify Focus, and it's the most studied astaxanthin on the planet, and it's one of two that has no impurities in it. So if you're getting astaxanthin, make sure it says astereal astaxanthin. All right.
Is she related to Selig Hecht, who was the eye researcher?
I have no idea. idea.
Okay, well, you're going to ask her.
I'll ask her.
Have
All
a great
Steve.
Saturday.
Have
God
a good
bless.
one. All right, Roger, I think you're biting at the bit.
Yes, there was a news story I heard. This has made the national news yesterday. A study just came out. It's called the VITAL study, vitamin D and omega A3 trial. VITAL. It was co-led by Mass General, Brigham Hospital, and the Medical College of Georgia. Harvard was involved. It's the first large-scale and long-term randomized study to show that vitamin D supplements protect telomeres and can lengthen your life. 3 years was the thing that they...
What study was that?
VITAL, VITAL.
And the VITAL study also showed that it decreased myocardial infarctions by 40%.
Yes, and it also...
From taking 1 gram of omega-3 fish oil.
Yes, and it got rid of... it cut down on selected chronic diseases of aging, such as advanced cancer and autoimmune disease, among other things. For me, it helped me with joint pain I had for many years. That was a personal thing, but I was so interested in this because this is the first randomized study, large scale, to show that vitamin D supplementation protects telomeres and preserves their length. Those telomeres are the things that kind of fray on the end and cause aging. So this is a very big deal. And they've had small scale studies in the past, but this is the first really big study. And compared with taking a placebo, it significantly reduced the telomere shortening and prevented the equivalent of nearly 3 years of aging. That is really a big deal.
And that's one reason the sunshine in moderation is so important for that, vitamin D. It's vital. A vital study, vitamin D.
Yes.
Vitamin D is vital, but too much, more is not necessarily better. So I think the consensus is if you're about average size, you need 1,000 to 2,000 units of vitamin D3 a day. If you're really big, you can take up to 5,000 units. You need to get a 25-hydroxy blood test done through your primary care physician, and those levels should be anywhere from 60 to 80, not higher than 80. Now, here's an example of taking too much. My brother, who's relatively intelligent, I thought, was taking some vitamin D that I got him, and he thought they were 1,000 units, but they were 5,000 units. And so he didn't read the label, and he was taking 5 a day.
Oh.
So 5 times 5 is 25,000 units. Plus, he's laying out the sun for 2 hours, riding his bike, mountain bike, and everything in the sun. He had his 25-hydroxy test done, and it was like 140. Way too high. So it was his own fault, excuse me, but his own stupidity that brought this on, Rick, if you're listening. And he's got some health problems related to that. One thing, he has atrial fibrillation, and it very well could be related to the extreme elevation in vitamin D levels. So he's staying out of the sun, and he's off all vitamin D, and hopefully some of his health problems go away.
But this time of year, you can get vitamin D from the sun. You don't necessarily need supplementation all the time, but you have a wonderful product I've been taking for 15 years, the fish oil pills, as I call them. You have the official name. It's the
Fortifeye Super Omega.
Yeah, and that's the best on the market as far as I'm concerned. A lot of them that you pick up in some of these drugstores are not that great, but this is very effective. I had a shoulder injury that I thought was going to require surgery many years ago. Taking these supplements have really helped that. I really don't have a problem with it at all now. So it is a wonderful thing. I also get a lot of sun. and take those supplements. I've been fine ever since.
That's 2 things for anti-aging to our list today, omega-3 and vitamin D. So or eat wild Alaskan salmon and get in the
Right.
sun, or take Fortifeye Super Omega and a good vitamin D supplement. I wouldn't take over 2,000 units unless your doctor prescribes it. All right, we're going to the phones. We're getting loaded up. Let's go first to Sherry in Fort White. Sherry, good morning. Thanks for holding.
Good morning. I was recently diagnosed with osteoporosis. Is that the brittle bone disease?
Yes, ma'am, it is.
Any suggestions on supplementation or diet?
Well, I would definitely follow your doctor's advice on that. And there's certain medications they can prescribe. But from a holistic approach, I would do some weight bearing exercise. I would get some sunshine. Don't be afraid of the sun. 30 to 45 minutes of sunshine without sunscreen, unless obviously you're recovering from melanoma or skin cancers, or you're an albino and you're on medication that makes you light sensitive. But a little sunshine is good. I would eat some sardines with the bones, all right, because that's a form of calcium called hydroxyapatite. And I would eat some cooked, gently steamed, boiled, organic baby leaf kale or regular kale. The kale is very high in vitamin K that helps the calcium absorb. The sardines are very high in omega-3, but most importantly, that special type of calcium. So the combination of that calcium, the vitamin K, and the sun, and some weight-bearing exercise, you can do it all out in the sunshine, is very good for your bones for sure. But definitely, your doctor's going to want to follow up on that with certain tests and blood tests and bone density scans, and sometimes recommend some specific drugs to help with that. But as you know, I'm a big advocate of doing everything as natural as possible. And then the other thing is, try to get down to your ideal body weight. All right. If you're overweight, do everything in your power to lose that body weight. That's going to help reduce a lot of the tension and the stress on your bones and your joints.
Okay. Can I come down to your Eye Care Institute and get like a nutritional consultation?
Well, yeah, the first thing I would recommend is setting up an appointment to see me or Dr. Somerton, because we're both certified nutrition specialists. And we do a comprehensive evaluation of your body. We do an optomap. We look at the blood vessels. We look at the nerves, everything. We look at the capillaries under your retina. We even have non-invasive angiography we can do now that looks at how the blood vessels are reacting to your systemic problems or potential problems. And that gives us an idea. It gives us a snapshot into your future, believe it or not, and how you're reacting to diseases. We can tell whether or not your high blood pressure or diabetes and atherosclerotic plaque is really causing a potential problem through the eye. So that helps us gauge what's going to be beneficial for you. And then what we'll do is include a summary, and we'll talk to you about nutrition, talk to you about what foods to eat, what foods to avoid, what supplements to take, what supplements not to take. And we'll go over it with a fine-tooth comb. And then since you become my patient, if you're not already my patient, you get my phone number and my email address. And, it's an ongoing relationship.
Where's the nearest Eye Care Institute of Cal?
Now, the closest one that I see patients at would be the Lange Eye Institute in the Villages. Lange Eye Institute in the Villages.
I did come see you many years ago when you were over off Archer Road.
Oh, in Gainesville. Yeah.
Yeah, that was a long time ago.
It's time to make a drive to the Villages.
I think so. And it's called the Lange Eye Care Institute.
The Lange Eye Institute in the Villages, Florida. Yes, ma'am. And you just go to drmichaellange.com or langeeyecare.com.
Okay, great. Thank you very much.
And you can get 15% off on certain items, doctor. I just saw that 15% off.
Why don't we make
weekend.
it 50% off?
50? Okay.
Yes.
50%. That sounds even better. I'm going to pick up some vitamins now.
I'm on a wild ride this morning. We're going to do 50%. No, we're doing a 50% off some frames for people that are listening. Let's do 50% off Cartier frames, Saint Laurent, and let's throw in Gucci too. Now, if the Gucci and Saint Laurent and Cartier reps, they're cringing if they're listening right now, because you're not supposed to do any discount on these name brands. And if you look right now, I got a pair of Cartier sunglasses on. Pretty cool aviators made by Cartier. Aren't they lovely?
just delightful. I'm going to steal those when you're not looking.
So let's do that. Let's run
50%.
50% off Cartier, Saint Laurent, and Gucci at the Lange Institute. So it's worth driving from, Miami or Atlanta, because some of these Cartier frames are over $5,000, and you get 50% off on them. Yes, some of them are
People pay that
$6,000,
much?
$8,000 for a Cartier frame, and some of them are, $500. But there is no place that I know of in the state of Florida you can get 50% off Cartier or Gucci frames right now. They might want to pull the line, but more power to them. I'm on this wild ride this morning, so we're doing 50% off for the Memorial Day week. And what we'll do, I'll run it for 10 days starting right now. Let's make it 2 weeks. 2 weeks starting right now. 50% off Cartier, Gucci, and Saint Laurent. But yes, you can get 15% off the Fortifeye vitamins when you buy 3 or more of any of the Fortifeye vitamins. And online, I think you can get even up to 20% off when you buy more. You can see when you go online at fortifeye.com. And I got to tell you, we have not raised the prices have gone up significantly. We haven't. Fortifeye comes from China, none of it. But the caps and the bottles and the bags, those all come from China, and they've gone up significantly. So you're going to see your vitamins going up in cost. I'm not going to raise vitamins. At least I'm saying that right now. I'm not raising our cost on vitamins, but we do have to eliminate some of the big discounts that a lot of you used to get. Some of the old timers that have been seeing me for 30 years, come in and want this huge discount. 15% when you buy 3 is all we can really do right now. Maybe 20%. That's the max, depending on how many you buy. But check it out at fortifeye.com. That's Fortifeye, fortifeye.com. And we're getting loaded up. Let's go to Nancy in Seminole. Nancy, good morning.
Good morning. I love your show. I just want to ask you, my situation is troubling me right now. I had a hemorrhage in my left eye. I have wet macular degeneration, and it just happened last month. So I had been getting and I'm still getting Avastin shot.
Right.
So I'm wondering how long it would take for that blood to go away.
All right. So blood in the eye, especially if you're having an anti-VEGF injection like Avastin or Lucentis or Eylea, some of the other ones, it's everybody's different. It all depends on you, your weight, your blood pressure, your blood sugar. So some people, it can take months and months and months. And some people, resolve relatively quickly over a 2 to 3 week period. All right. So everybody's different. Obviously, the things we talk about in this program, proper diet, proper supplementation, weight management, exercise, all of that's important. And the other thing is depending on medications you're on. So obviously somebody that's on a blood thinner like Eliquis or Pradaxa or warfarin or Coumadin because they have atrial fibrillation or if they had a stroke, they could bleed more intensively than somebody that's not on a blood thinner. So it's kind of tailor fit for each individual, but seeing the retina specialist is crucial. And we're blessed in Florida to have some of the best retina specialists literally in the country because everybody has, retinal problems as they get older. The majority of us do. So we got a lot of great retina docs in the area.
Okay. Well, my weight is 151 and I'm 5'5". My blood pressure is normal with medication. And I'm pretty healthy. I exercise and eat pretty good, normally. So I don't know what else to do.
And you're wearing sunglasses when you're out in the sun?
Yes, definitely.
Are you taking any supplements that are made for macular degeneration?
The doctors recommended the AREDS, Preservision, AREDS 2.
Right. I don't love that for many patients because it has a lot of zinc in it. But if your doctor recommended it, I think that's a good idea. We developed one called Fortifeye Advanced Retina that is based on the AREDS 2 study, which is a good study. But we cut the zinc back to only 30 milligrams and did away with the copper. And we put natural vitamin E instead of synthetic vitamin E. And we added astaxanthin and resveratrol. So, of course, I'm a little bit biased, but if you ever want to change, I would recommend looking at the Fortifeye Advanced Retina formula because it is basically the AREDS 2 with a little bit lesser zinc, and we added some nutrients that I think is very beneficial at helping support retinal health. But remember, there is no vitamin out there that is a cure. It will not reverse wet macular degeneration. Basically, it's giving you the nutrients that your retina is thirsting for. And, just maybe it works in conjunction with the injections, and helps you along the way, basically.
One thing I looked at the label here, I noticed the astaxanthin is not included in this.
No, there is no astaxanthin in that formula. We do have it in our advanced retina formula. And also, I'd recommend eating more dark green leafy vegetables that are gently cooked, like baby leaf kale or organic kale. I would eat more blueberries, organic blueberries, wild Alaskan salmon, eggs, believe it or not. There's a study out there showing that if you ate 4 eggs a week, just 4 eggs a week, you're less likely to advance in macular degeneration. And then if you're going to eat nuts, do not eat almonds, do not eat peanuts, eat pistachios.
Wow.
And if you eat those foods and take the right supplements, a little positive mindset, continue to follow up with your doctor, you'll live to 110 and hopefully you won't lose any more vision.
Well, I'm 85, almost 86, so I'm doing what I can, but I think your advice is just great.
And we've got a lot of advancements, Nancy, coming yearly for macular degeneration. So what we're doing and recommending today, we'll probably be laughing about it in 3-4 years, saying, wow, I can't believe that. So we're making some positive steps in the right direction.
Well, that's good news. And I'm going to order some of your products. I did have the fish oil, but I ran out of it. And I see you have 15% off if you get 3 or more.
Yes, ma'am.
Okay. I'll take advantage of it. Thank you so much.
All right, Nancy. You have a good one. Take
care. You too. Bye-bye.
All right. You're listening to Ask the Doctor. Not Ask the Doctors, although both of these gentlemen sitting to me have listened to the show for a long time because they could be junior doctors. That's Dr.
Honorary.
That's Roger P. Honorary. Roger P. Schulman and Scuba Scott. Give us a call at 813-282-8283 if you'd like to look at some of the supplements that we've developed. You can go to fortifeye.com. That's FORTIFEYE, fortifeye.com. And we also have the Next Gen Macular Defense. That's my favorite supplement, Fortifeye Next Gen Macular Defense. And you can go to the website, you can click on the vitamins, look at the discussion, look at the study section, and see the reasoning behind the ingredients. Remember, supplements are only supplements to your diet. They are not cures. They are not treatments. I've been doing this a long time, so I'd like to think I'm as good as anybody in the world at developing these supplements to try to help you. Remember, they're not a cure and they're not a treatment. All right, we're going back to the phones. I think it's Rosie or Rossi in Ocala.
It's Rosie.
Hey,
How
Rosie.
are you today?
Good morning.
I got a list, but to get to what I really want to talk to, I just want to make a comment on the vitamin D3. When a blood panel was done on me, they found I was very deficient in that, and the doctor had told me that it was affecting my kidneys. So, and he said that many people in Florida are very deficient in D3 and don't even know it, and we live in the Sunshine State. So I just wanted to make a comment about that. Let's see, what was the other thing? So I did want to talk about bruising because I'm on blood thinners, and of course, when I tell that to the doctor, the cardiologist, he says, that's not causing your bruising. So it just seems like I just have to rub up against something, and there you go, my bruise for the day. What can I do to help this?
All right. Well, I would beg to differ with the doctor. I mean, anybody that's on any type of blood thinner is definitely more prone to bruising when you knock into something. Okay. And then when you add, it all depends. A lot of people are taking lots of supplements that actually thin the blood even more. All right. So some of the supplements that I recommend, being counseled with your physician before taking are things like ginkgo biloba, nattokinase, ginger, even curcumin in high dosages, vitamin E, garlic, and omega-3, but you really got to take upwards of 4,000 milligrams of omega-3 before it starts to interfere with blood thinning properties. So just one omega-3 like the Fortifeye Super Omega usually works well with blood thinners. But you have to be very cognizant of supplements people take. A lot of people are taking supplements they don't realize they have blood thinning properties because it's a blend of nutrients and they're not sure how much of what is in each one. And this is oftentimes before surgery, before we at the Lange Eye Institute do lots of lid surgery procedures. When we were doing a lot of oculoplastics, we would always stop. First would have to get authorization from the doctor to stop the blood thinner and would stop all the vitamins that they're taking just to make sure for usually 5 days. So look over the supplements that you're taking and, see if you have any of these potential supplements that have blood thinning properties on top of your blood thinner. And then obviously your doctor needs to run specific blood tests to look at your blood to see, in layman's terms, how thick or how thin the blood actually is. And dark green leafy vegetables are not a bad idea as long as you're not on Coumadin or warfarin, because that gives you the vitamin K that also can help with the blood and help with clotting.
Interesting. Is there anything you can put on your skin or do anything on a daily basis to help this?
Yeah, I mean, I've seen, people talk about certain creams that build the epithelial barrier. I haven't seen any good studies that prove that. I think, astaxanthin, lutein, and zeaxanthin definitely have some skin promoting properties and some science out there that may point to it helping not only the elasticity of the skin, but the elasticity of the blood vessels as well. So something that contains these carotenoids, lutein, zeaxanthin, and astaxanthin. Of course, the one I developed is called Fortifeye Focus, but you don't have to get Fortifeye Focus. You can use that as a template and find something that's very similar to it. If you're getting astaxanthin, make sure it's got at least 6 milligrams of astaxanthin, and it comes from real astaxanthin. But I put a lot of my patients, especially diabetics, on this because diabetics have very leaky, more prone to break down blood vessels that are very fragile. And I've put them on the Fortifeye Focus for years and years and years. And oftentimes they do quite well on it. I don't know of any double-blind placebo-controlled study proving this, but I know that we discussed this with Dr. Karen Heck, who's a leading authority on astaxanthin, a few years back on this show. So it's certainly something that's beneficial. So either take something like Fortifeye Focus or eat more dark green leafy vegetables, orange bell peppers, goji berries, and wild Alaskan salmon.
Got it. Wow. It seems like it's all food.
Well, food is medicine.
Food is medicine.
Food is medicine, and you are what you eat. So, God put these foods on the planet for us to consume. And the whole key is to try to consume foods that haven't been overly polluted and adulterated and commercialized. So try to, when you shop at the store, shop at the perimeter where all the fresh produce is, and try not to get canned and frozen and overly processed foods. And hopefully we all live a little bit longer.
Great. Do you want me to bring up what happened to me last weekend at the pool?
Yeah, yes, you can bring that up. Absolutely. We got a few more people on hold, but that's not going to take long. Yeah, let it rip.
Okay. Well, I just wanted to tell people something that you don't always know when they dump the chemicals in your community pool. Okay. And where I live, there's 9 swimming pools, so I'm not going to go to that one. But there's one pool that they take care of really nice, which I figured it out, and that's where I will swim. Because sometimes when they put them in, the pump may be not circulating the chemicals properly. Even though you when you go in, you feel something moving, but it's not really moving the chemicals. So what I'm trying to say is, last week I had to talk to the doctor because my eyes got really irritated, which lasted over a day, where I could actually see right. And in addition, I absorbed this chemical in my skin and had total muscle weakness and pain in my whole body for the rest of the day.
Well, yeah, you developed what we call a chemical conjunctivitis, a chemical keratoconjunctivitis, and that's related to the high concentration of chlorine. It's toxic to the eyes. And so you got to be very careful. I mean, if it really smells and reeks of chlorine, you probably shouldn't get in that pool for a while until it dissipates. Or what you can do, Rosie, is find a saltwater pool. And saltwater pools
Yeah.
have a lot less chlorine in it, and I think are better because you're not going to, absorb. Remember, the skin is the biggest organ in your body, and when you're in that pool, it's absorbing everything. So saltwater pools are ideal.
Well, it was a big learning lesson, and I wanted to share that. And so, what the doctor recommended to me is just keep pumping eye drops in my eyes. I mean, it actually wrecked my vision, and the pain was just really bad. So that's it. I have other things, but other people are waiting to speak. So you guys all have a great day.
Thank you, Rosie.
Well, this is the Memorial Day holiday weekend, and a lot of pools are all over the country open on this weekend. And I did learn something interesting. Most pools are blue on the bottom, and a lot of kids have blue bathing suits. Lifeguards can't see very well, particularly if they don't have polarized glasses, and kids drown in some cases. It's best to have another color, yellow or red, so they're more visible if they're under the water. That's something we learned that is a good tip if you got kids in the pool.
Wow, don't wear blue bathing suits.
Right, don't wear blue bathing suits, or if you do, wear something else so you're more visible. Blue just blends in.
It's also a good idea to take some artificial tears, some preservative-free artificial tears. Of course, I like Optase or Oasis. You can get those on the Fortifeye website. Take those to the pool when you're a kid, or when you get out of the pool, just douse your eyes with that really good. That'll irrigate out any of the potential chemicals that are harmful to your eye. But, it's kind of a catch-22. If they don't put enough chemicals in it, then there's a lot of potential pathogens in there, like acanthamoeba, pseudomonas, and lots of bacteria and parasites that aren't good. So they do have to kill it. But I love saltwater pools. All right, let's go back to the phones. Let's go to, I think it's Andy. Andy in Largo. Andy, good morning. Thanks for holding.
Morning, guys. I appreciate the show as well. And all the products. I just wanted to say I'm taking the Mac Defense Zinc Free at your suggestion. And when the young lady just called in named Ruth and whatever and asked about her wet macular degeneration, you did recommend the AREDS, your product, advanced retina therapy or whatever, which I want to buy probably later today if I can get up to the store. But you didn't mention that she should be taking Mac Defense, and I didn't know which one is more important, that you would mention the advanced AREDS or whatever, advanced retina therapy, and not necessarily your wonderful multivitamin Mac Defense Zinc Free.
Right. So, Andy, I was trying to be as politically correct as I could be, because her doctor had recommended the AREDS too. And so I didn't want to step on anybody's toes. Most of people know what I feel about that particular supplement, but it's certainly better than nothing. But many people, and the reason we developed the zinc-free next-gen macular defense, we were involved in some clinical studies that we actually tested the DNA of our macular degeneration patients. And we found that a relatively large percentage of patients, based on their DNA, were having a negative reaction to the zinc. So I was the first in the world to come out with a zinc-free macular defense vitamin. And we basically ask 4 questions now after, thousands and thousands of patients, and doing this for a long time. I developed a 4-question protocol to determine whether or not you need zinc or you don't need zinc. And we ask the question, are you a vegan? If you're a vegan, you need the one with zinc. If you're not vegan, you probably don't need extra zinc. All right. If you're on a diuretic, you need the one with zinc. If you're not on a diuretic, you don't need extra zinc. If you have Crohn's disease or ulcerative colitis, you need some extra zinc. If you don't have Crohn's disease or ulcerative colitis, I would get the zinc free. And then finally, depending on how much you party and partake in the alcoholic imbibing, if you drink more than 2 alcoholic beverages a day, you probably need the one with zinc. So a lot of people will fall into no zinc. Remember, during the pandemic, people were pushing zinc everywhere, and people were almost ODing on zinc because they were taking way too much, but yet they were still eating the oysters and the steak and everything that's high in zinc. So remember, more is not better. So I recommend the Fortifeye Next Gen Zinc-Free Macular Defense to the majority of my patients, unless they answer yes to one of those 4 questions. And those questions are on our website at fortifeye.com. And you can go to Next Gen Macular Defense, and you can see those questions and read about why I put specific nutrients in it. Remember, AREDS 2 is an older study. It's over 20 years old, and it's basically talking about vitamin C, vitamin E, zinc, copper, lutein, and zeaxanthin, and that's it. So we have all of that in the next gen macular defense, but we've added saffron from the saffron studies, the bilberry and pine bark extract, the taurine, the B complex from the B complex studies, and the astaxanthin, more lutein, double the amount of lutein, zeaxanthin, and mesozeaxanthin, plus many other ingredients that have been shown in smaller pilot studies to be beneficial for the retina. So when we combine that with the right diet, wearing a good pair of sunglasses, weight management, it's very powerful at helping people with macular degeneration.
Oh my goodness, that was a thorough explanation. I do appreciate it, Dr. Mike. Follow-up question, if I'm not keeping you from Stephen calling in with his fascinating
or
input.
Bob.
Or Bob.
Yes, but I was just curious, for facial skin tone tightening and whatnot, because I have saggy skin, and my girlfriend, Coco, she looks younger. She's 12 years older than me, and every morning I look at her and say, "You're getting younger every day, and I'm getting older." Could be I'm charging 2 cell phones next to me at the bedside table, but
right,
all the EMF. But I was just curious, which is better for tightening up my saggy 70-year-old face, the Focus and Brain, or the powdered product, Rejuvenate?
Rejuvenate, definitely.
Okay.
Yes, Rejuvenate. And I would take 2 scoops a day of Fortifeye Rejuvenate. Remember, Fortifeye Rejuvenate is a combination of a marine collagen tripeptide. We're one of the only in the United States that are using this, because it's been in Europe for many years now. A tripeptide absorbs much more readily than a peptide. And if you look at your collagen, look at it, it says collagen peptide, all right? So we're using a collagen tripeptide. That's beneficial for the skin, the elasticity, the wrinkles, the hydration. We added German hyaluronic acid. We added riceramides for the crepey skin and the rough skin. We added Dermaval, which is 9 superfoods that in 3 clinical studies has been shown to actually rebuild elastin and collagen in the body. We added a little biotin for the hair. I added liposomal vitamin C called Pure Whey, made right here in America, not China. And we added a very mild multivitamin mixture. I love the cherry vanilla. That's my favorite, but we have in pink lemonade and chocolate, all naturally flavored, no artificial flavors. But it is good. It's helped my joint pain tremendously. I think it's helped my skin. My wife, it's helped her hair. I've literally got thousands of patients taking it. So it is probably, and of course I'm a little biased, one of the best supplements on the market, especially at the price of only $39. We can't even sell it on Amazon because I'd lose money. For the price, you can't beat it. If you look, just the Dermaval that is in it alone oftentimes sells for $49 online, just for the Dermaval. So we don't have much of a markup on this at all. I wanted to bring something based on the latest evidence-based science for skin, joints, hair, and to the market, so it's affordable. So definitely worth trying. Also, while you're on, before we go to the next call, I'm holding something up in front of the video right now, and it's called OptiLift. So OptiLift helps with lower lid laxity. It's a pretty amazing technique or technology. We have it at the Lange Eye Institute. It's made by Luminous. It's called OptiLift. It's a non-invasive device that uses something called dynamic muscle stimulation, or DMS, and RF frequency to address lower lid laxity and impaired blinking. And what it does, it tones the facial muscles around the eye. It's a non-surgical solution for a lifted appearance, basically. And we've done a lot of patients. They've done quite well. It helps dry eye. We use it on patients that have meibomian gland dysfunction, dry eye, lowered lid laxity, something called ectropion, where the lids actually turn out. We've had great success on patients with Bell's palsy. So that's something you can always think about. It's not covered by insurance. It's not super cheap. It's not terribly expensive. It's $500 a treatment, and I think 4 treatments is required every week. But you can keep that in the back of your mind, Luminous OptiLift. And if you want to see somebody that does it in the area, a doctor, you can go to the luminous.com website and you can look at the doctor locator to find a doctor in your area that's doing it. But what I like about it, it's non-invasive, it's not surgery, it's painless, and it works.
Right, and and I appreciate your thorough explanation as well, and the time you've allowed me to be in conversation with you, benefiting everybody on the radio. I wanted to ask you, what is the infrared protocol that you're starting to offer? Is that like 6 treatments up there or 4 treatments?
Yeah, so
and it has to be done.
Yeah, that's the IPL. That's it's intense pulse light therapy. That's also 4 treatments. It's a kind of a form of photobiomodulation therapy, and we're gearing up to put retinal photobiomodulation therapy in the Lange Eye Institute also. It probably won't be to the end of the summer or the late fall. So we're engaging in some pretty exciting new generation treatments to help the eye. Absolutely.
Well, what is the benefit of that infrared versus the lower lid protocol you just described at $500 a visit?
Right. So the IPL is actually used for opening up the meibomian glands. It targets inflammation in the meibomian glands. All right. OptiLight is what it's called. It's the only FDA approved IPL for dry eye. And they actually, Luminous invented the IPL. They're the first, like I said, first and only FDA approved IPL for the management of dry eyes due to meibomian gland dysfunction. And what this does, it reduces inflammation in the meibomian glands and improves something called tear breakup time. It destroys these abnormal blood vessels that cause inflammation that people get as they get older. And also people with rosacea and acne in the past get this. It improves the meibomian gland morphology, all right, and functionality. And it also, here's the kicker, it decreases the population of Demodex mites on the eyelashes. So it's a targeted, precise, controlled treatment that is painless. It takes about 15 minutes. It takes 4 treatments. And we've done hundreds of patients with this. And it's mainly for people that have really significant dry eyes. But we're also doing a little bit of this on your cheeks. So think of it as almost like a photofacial. We decrease the inflammation in the upper cheeks. That decreases inflammation in the meibomian glands. So it also gives the skin a little healthier appearance as well.
Thank you, doctor. And with respect to every night now, I cleanse, I make sure, and I'm a guy, remember that. So a lot of guys don't give up the darn about their face and caring for their facial skin until they're in their 40s or 50s or 60s. I wash my face every evening, but I don't have your tea tree based wipes. I wash with maybe Dr. Bronner's Castile soap,
sure,
and then maybe Neutrogena as well. Do you think something like that is effective against the dust mites that are, breeding and
the
using
tea
my
tree
eyelids as a toilet?
Either Ocusoft Demodex Oost or Optase tea tree oil lid wipes are going to be much more effective for Demodex mites than what you're talking about. Also, I'm going to plant this seed. We got to take the next call, but I'm going to plant this seed. We've been using a new product called Skin One, and they got a great eye cream and a face cream and a great cleaner as well. But we gotta go to the next call, okay? Andy.
Thank you. Take care. Have a great weekend.
All right. Bye-bye. Let's go. I think it's Margaret in Tampa. Margaret, thanks for holding. You've been very patient.
Yes, good morning. I want to ask you a question. I have a macular hole in my right eye, and it's, of course, as you know, it's completely detached. Is there anything can be done to correct that?
How long have you had the macular hole?
Well, since 2012.
Yeah, it's probably a little late. I mean, I never say never, okay? I would go see your local retina specialist and find out for sure. I mean, they have had, new procedures using amniotic membranes and things like this to help close holes, but it's been quite a while, so I wouldn't want to give you any false hope, all right? But that doesn't mean that we won't have something in the not so distant future, okay?
Okay. And you basically answered my second one as I was listening about the collagen. I heard some of the things that it's good for. What else is it good for? It's just taking collagen. And I've been using the kind with multi in it.
Right. The multi-collagen, they have 5 different collagens usually, and it's usually a blend, and you don't know how much of each collagen. So I don't like those type of blends. That's why I created Fortifeye Rejuvenate. It's fully transparent. I tell you exactly what's in it. And we are using the most bioavailable form of collagen. It's a marine collagen tripeptide. So if you get bored, go to fortifeye.com and look at the Rejuvenate and look at all the science behind it, okay?
Okay. Thank you.
All right, Margaret, take care. All right, I do want to talk. We got not much time, but Roger, you tried the 4th prototype of the Fortifeye Fit Meal, chocolate and vanilla. What did you think?
Absolutely spectacularly good. It was really good.
I think we got a home run there.
I think so.
The first one was too sweet. The second one wasn't sweet enough. The third one wasn't perfect. The 4th one is perfect. So the 4th prototype, I think we hit a home run. We're going to go to manufacturing. This is going to be one of the first evidence-based meal replacements toward people helping anti-aging and weight management. It's amazing what we're putting into the Fortifeye Fit Meal. So if you're overweight, you just want to have a drink that's going to be great for total wellness and immunity, the Fortifeye Fit Meal is going to be it. We're still a couple of 2-3 months away. Roger, Scoobs, thanks for being guest on Ask the Doctor.
Thank you.
Thank you.
All right, with that, I want to wish everybody a happy and a healthy Memorial Day weekend. God bless you, and God bless America.